Hi everyone, welcome to PHARMA Overview. In this video, I am doing a brief review of emerging of psychedelic medicines. What are psychedelic medicines? The term psychedelic means mind manifesting. So psychedelic drugs, also known as psychotomimetic drug or hallucinogen, and it is a type of drugs that are able to induce altered thoughts and sensory perceptions. The term psychedelic was coined by the psychiatrist Humphrey Osmond. About the types of psychedelic medicines, there are different types. One is lysergic acid diethylamide, which is called as LSD, and it is a powerful drug and it is developed from ergot in rye plant. Another one is dimethyltryptamine. It is a naturally occurring plant-based drug seen in barks and nuts of some trees, and its effects are comparatively shorter and its action will last only for 1 hour. And another one is mescaline. Mescaline is a constant found in peyote cactus. And another one is psilocybin, and it is found in magic mushrooms. Next, about psychedelic therapy or psychedelic assisted therapy. Psychedelic therapy is different from the conventional therapy. In conventional therapy, patients usually take the medicines without supervision at least once or twice daily. But in case of psychedelic therapy is happening in 2 or 3 sessions, and this therapy used as an adjunct to psychotherapy or counseling for mental illness. And this proposed use of the psychedelic drugs is to treat the mental disorders such as obsessive compulsive disorder, post-traumatic stress disorder, alcoholism, depression, and cluster headaches. And these psychedelic drugs are mostly the controlled substance in most of the countries, and therapy is not legally available outside the clinical trials with some exceptions. And this psychedelic therapy is like a rebooting a computer. Means that it induces the brain to allow a reset to take place and permit to alter the previously stuck feelings or emotions and thoughts. So psychedelic drugs put the patients into a transient state where they can better process memories, feelings and post-trauma and re-emerge with a new perspective of freeing and healing. And these psychedelic drugs are not at all addictive and well tolerated, physiologically safe, and do not give rise to any severe or persistent adverse effects. And therapy is adopting the microdosing technique, that means taking the doses below the hallucinogenic threshold. And about the mechanism of action of psychedelics, the psychedelic drugs are 5-HT2A receptor agonists, means serotonin 2A receptor agonists. How psychedelic medicines will work? Psychedelic drugs increases the amount of serotonin by binding to the serotonin receptors in the brain. And as you all know, serotonin is a neurotransmitter that helps to regulate your mood. And when more serotonin binds to specialized receptors, it may help the patients to feel more comfortable and stable. And about the procedure for psychedelic therapy, these psychedelic drugs usually take 20 to 40 minutes for the onset of action, and it lasts around 6 hours depending upon the type of drugs used. And the therapeutic team prepares the patient for the experience beforehand and helps them to integrate insights from the drug experience afterwards. And after ingesting the drug, the patient normally wears the eye shade and listens to music to facilitate focus on the psychedelic experience. And the therapeutic team will interrupt only to provide a reassurance if any adverse effects such as anxiety or disorientation arise. And about the effects of psychedelic during the therapy is altered perception of time, difficulty in communication, hallucinations such as hearing sounds or seeing images that are not real, increased energy, lack of ability to think rationally, nausea, spiritual experiences, vivid sensory experiences, and some short-term side effects like increased heart rate, increased body temperature, dizziness, increase in blood pressure, loss of appetite, dry mouth, sweating, numbness, weakness, tremors, and impulsive behavior. Researches are ongoing using this therapy with various drugs. So that's about the small brief review of psychedelic drugs and its therapy. If you find this video useful, you like, share, comment and subscribe. Thank you for watching Pharma Overview. Bye. See you in the next video.